My name's Thomas Halligan. I am from Norton, Vermont. I graduated from Canaan Memorial High School in 2022, and I attended the Institute on Health and Medicine in 2019. So I'm a rising junior studying biological science at UVM. I keep involved with all sorts of healthcare things, a member of UVM Rescue on the university's rescue squad, also on Cambridge Rescue. I am on an ambulance back home in northern New Hampshire, and I also work in an emergency department. So I think there's so many different opportunities with all the different institutes, and my guidance counselor reached out to me about that. I was still in between what I was hoping to do after I graduated high school, and I always thought health and medicine was the thing for me. And I think just the main part that really struck me is just being able to gather a group of such awesome people from all around the state. With it being so rural in Vermont and graduating from a super teeny high school, I knew the same like 20 kids for all 4 years of high school and then all of elementary school and all of that. So it was really nice to meet some people from all around the state. I really enjoyed when the surgeon came, kind of stitched up a banana. That was awesome. And played with like a laparoscopic surgery simulator, and just really talking to all the people from all the different health careers was really beneficial. And the mentors were awesome. Definitely pushing out of my comfort zone, just interacting with all these random people. It was certainly awkward on the first day where we all sat around and had the first briefing before we got going, but then it was like, okay, these people are awesome. So I started doing EMS things my sophomore year in high school. I did the EMT program through our technical center at our high school. I went through that, tested, but I was kind of in a lull period because I had, nationally I was certified as an EMT, but the state wouldn't give me a license until I was 18, 17 at the time. So that's when I got a job teching in the ER at a local hospital. That was an awesome experience. Still work there today. And then my senior year, I was looking for some other thing to fill up my schedule, so I came back with the EMT program again. I was kind of in the assistant instructor role. I just really liked that. I just really found I had a knack for sharing the knowledge, breaking it down in an easy to understand way, and just connecting with the peers. I wanted to do some other things like that, just teaching. Kevin reached out, he was like, we have this program, it's a week-long residential institute, just teaching Vermont emergency first responder type things. So I'm like, hey, I did the Health and Medicine Institute. Like, that'd be awesome if I could come back. It kind of like a full circle moment there. Once I heard all the opportunities and how we could just really portray it in a fun way, I was hooked. I was like, yeah, I'll definitely do that. And then it went so well, I was invited back and I gladly accepted to do both the North and South GIV Health and Medicine session this summer. Since then, working at Cambridge Rescue, we've had really staffing shortages, so we're really relying on many people that are Vermont emergency first responders. With 2 years left at UVM, I'm gonna keep doing EMS, keep being on UVM Rescue, all that stuff. Hoping to get my paramedic so I can kind of climb the pre-hospital ladder just to have a wider scope of practice and be able to help a lot more folks. And then eventually med school, eventually landing in emergency medicine is the hope in some kind of rural setting, because I really like how medicine has to be practiced in like a critical access hospital. It's really unique. One of the hard things is just being able to adapt really quickly to all the sorts of different calls we get. So we could be going from like a mental health emergency to someone with chest pain. So it's really takes being able to think on your feet and really adjust to the changing situations. And I think one of the most important aspects that I've learned is just really how to talk to people, because while it's awesome to be able to start an IV, give medications, things like that, you can't do any of those things if you're not able to actually talk to the people like people. It's really interesting just comparing the resources we have here in Burlington versus back home in northern Vermont. Especially in rural Vermont, just bringing these people to the hospital, and there's unfortunately very few mental health resources. It's really helping to highlight my passion for rural healthcare, because I really enjoy going back home, getting to serve my community on the ambulance and in the ER. I want to eventually work in rural healthcare. I'm thinking emergency medicine, just so I can help the rural communities, because we're really lacking in resources. I think one of the biggest pieces of advice, if you're interested in a career that someone's in, everyone's so willing to share. They really love young people being involved, so just ask. Most places can do ride-alongs, and everyone's just so willing to share their knowledge and their experience and really because we definitely need a lot of people in this field for sure, because it's so crucial that we have like a really good workforce in all aspects of healthcare, from EMS all the way up to like advanced providers. So get yourself out of your comfort zone, what we call like the growth zone. You want to be a little bit uncomfortable so you can learn more and grow, and yeah, get all the experience you can. It's definitely worth it for sure.